You're listening to the ATS Breathe Easy podcast, brought to you by the American Thoracic Society.
Welcome to the ATS Breathe Easy podcast. I'm your host, Dr. Erika Moseson, a pulmonary and critical care medicine physician in Portland, Oregon, and host of the Air Health, Our Health podcast. I'm here today with Dr. Crotty Alexander. Dr. Alexander, will you please introduce yourself?
Sure. So I'm a physician, adult, and a scientist here at University of California, San Diego, and I've studied e-cigarettes for over 12 years now. One of my favorite topics.
Well, we are here today to discuss e-cigarettes and its use among children and adolescents, as well as what we can do to help them break free of nicotine addiction. So first, tell us about your own professional and research background and how you became interested in this topic of e-cigarettes.
Sure. So it was kind of interesting because I'm classically a bench researcher, meaning I work with mice, I work with cells, and I had started looking at the effects of cigarette smoke on bacteria because most research has been done in the arena of cigarette smoke effects on humans across the body. And when I was doing this, I was also in pulmonary clinic, and patients kept asking me more and more frequently whether they should be trying e-cigarettes to help them quit smoking. And I was like, I don't know. There's like no data out there. I have no idea if they're safe. I don't feel comfortable giving recommendations. And then I was like, what am I doing? Like, I am set up to study this. Like, let's take this to the bench. And I started vaping mice and vaping cells and just really
I hope you weren't vaping mice and cells, but exploring the vape effects on the mice and the cells.
There we go. Let's call it that.
Yeah, well, the first study we are going to discuss today is titled Vaping and Harm in Young People, an Umbrella Review, which was published in the Journal of Tobacco Control from the BMJ. And I found it really eye-opening myself as the parent of a young adolescent. Can you describe how this study was done and the questions it aimed to answer?
And along your point that you just made, I'm a parent of a 13 and a 15-year-old, and I feel like that has driven my passion for this area quite a bit and led me to be a little bit more involved in like advocacy and policy as well. Yeah, so this article was very interesting to me as well. I'd never really looked at an umbrella review. So systematic reviews, meta-analyses, I've read plenty of those, but this one was special being an umbrella review, meaning it's a review of review articles. So they were trying to capture as much information, like very broadly, and trying to target it down to adolescents. So by utilizing other researchers' efforts to sort of condense what is known about e-cigarettes, they use all of these existing reviews to condense the knowledge about what are the effects of e-cigarettes on adolescents down to this one paper.
And what did the study find about the link between e-cigarette use and using traditional combustible cigarettes? Because that part has always been a concern of mine.
Exactly. And that has been one of the consistent questions I get asked by parents and policy groups, schools. And they found a very strong association between initiation of e-cigarette vaping in adolescents and subsequent smoking of combustible tobacco, cigarettes, and hookah, shisha. And they also went a step further to say that it truly was like, that the vaping increases the odds of them adding in the combustible use by about threefold. And I was excited to see that because I'd been sort of presenting similar data, but from multiple different papers. And I felt like this way that they sort of took all the data out there and really synthesized it down just for adolescents, I felt like it was like pretty powerful the way that they stated it.
And so the special thing about this umbrella review, it sounds like, is because they were able to look at all these other reviews that had already looked at this question and pull out the adolescent data, their finding is actually much stronger than any one of these individual studies because they're so consistent. Is that correct?
Agreed. It's like an amplified signal where all 21 systematic reviews that they included all did find that association between e-cigarette use and subsequent initiation of smoking. And that beyond that, they could really tie it to a causal relationship Whereas a lot of these individual studies or individual reviews would say there's an association, but we're not sure that it's causal. But this umbrella really kind of solidifies our knowledge of it to say, yes, adolescents who vape, like that is causal. They are way more likely to initiate, 3 times more likely to initiate combustibles.
And even just as someone who's also done advocacy in this, when you start talking to, the youth who are affected, a lot of them say they grew up with the message that cigarettes are so bad, but you could totally see how this would be a gateway, right? Well, this is just, some bubblegum favorite thing that I'm sucking on. And then they realize, okay, gosh, I'm addicted to nicotine. Well, hey, here's the old-fashioned version and just moving right along. And kids that maybe never would have gone straight to a cigarette.
Right. And actually, I know we're going to talk about this a little bit later, but the unique thing about this article where they actually did involve youth in like how to frame these messages, like one of the things the youth were really upset by was the messaging they had heard to date being that e-cigarettes are safer than cigarettes. And, they're hearing that they're not addictive, that there's no problems with it. And it was interesting that they were so upset about it.
Yeah. Well, I'm a parent. I'm pretty upset about it.
Yes.
So what did the study find about the risk of e-cigarette use and the use of other substances?
Yes, and this has been an area that's really been up and coming in the last few years, since the association with combustibles has kind of been there for several years now, but that sort of raised eyebrows about, well, maybe this is leading to marijuana use, alcohol use, and even more illegal substances. And this umbrella review did find an association between all of those, basically. So, marijuana, alcohol, binge drinking, in particular, all being higher in adolescents who vape.
Yeah, and again, when we think about nicotine on the developing brain, one of the concerns that everybody always raises is the potential impact for mood problems, mental health concerns. And so if you're going to be using a substance that changes those, it's not surprising that other associated substances would follow.
And nicotine being one of the most addictive substances of all time, and it has such a powerful activation of the dopamine reward system. And, all of these other drugs activate that system too. And so, of course, if you don't have a vape available or, somebody's drinking alcohol next to you and you use that as a substitute and it will do the same thing, slightly different effects, of course. But again, like this kind of gateway effect.
Absolutely. Well, so speaking of that, what were the mental health impacts associated with e-cigarette use in adolescents?
So that was a really frightening section of the article because they found that e-cigarette vaping was associated with not only greater rates of depression, but suicidality. And they went even deeper with that in terms of, suicide attempts versus suicidal ideation. And they found increases in both of those. And in particular, the suicide plans were found to be greater in female adolescents. Which brings up another topic that there are sex effects, gender effects in tobacco, combustible tobacco that are very well known. Less is known for the vapes. And so this is like scary, but highly relevant information that the impact on the brain in these areas that are really powerful for mood are likely different between boys and girls.
And, beyond the mental health effects, what other risks to physical health come with e-cigarette use?
So the biggest signal to date is asthma. And I felt like these authors really did a fantastic review of existing data along those lines because that data had been a bit patchy across the board. And by doing this sort of like more broad analysis, they did find 47 primary studies that concluded there was an increased risk of adolescents who vape developing asthma or having an asthma exacerbation. So this is actually one of the strongest associations found in this umbrella review was that incidence of asthma slash, worsening of asthma in e-cigarette vapors.
And one of the things you'd already touched on that I found really surprising and actually I think important is that this study included patients and the community. Um, and I found that really powerful because, normally I'm reading a journal and I'm instantly thinking about my own patients in my community. But I do think we've seen in the world right now, or at least in our country, that the process of doing science and the medical community sometimes feels very, very far away from the people we're actually trying to help. So, is this typical for tobacco research, or what do you think this adds?
I think it's becoming much more typical, so I was really excited to see it in this one and in the next paper we're about to discuss. And as an e-cigarette researcher, I have always engaged with the community, with young people, because I didn't know what I was talking about when I got into the field. I was like, oh, e-cigarettes, and I'd read up on it. And then we started recruiting human subjects, and they were like, what are you talking about? We don't call them that. That's not how we use them. And I was like, oh, wow, like I need to be engaging with this demographic like on a very regular basis. Otherwise, I'm not going to be studying the right things or in the right way. So I was really glad that, yeah, in this review article of all things, they, involved this youth advisory panel of the UK Association for Young People's Health, and got their advice on, what their concerns were and how they should do their messaging, like what was the best way to convey the message that they found. And so I thought that was just a really cool way to involve this sort of target population and the population most affected by these results.
Yeah, absolutely. I mean, you make a better question, you're going to get a better answer.
Right. And like, us as scientists and physicians, like we're not always the best at speaking at the layperson level, really communicating what we know so that they can really understand it. And I felt like that is also a key reason to engage with lay people in general and your target demographic in the hopes that your work will actually translate, to the community rapidly.
You don't find it helpful to walk into your office and start talking about hazard ratios with your patients? I
No,
think that gets them to
totally.
quit right away.
When you become a member of our global American Thoracic Society community of more than 30,000 healthcare providers and researchers, you'll have access to cutting-edge science through ATS journals and publications, discounts on the annual ATS International Conference, CME, and ATS Ed Plus products, and a robust, collaborative online medical community of peers in our ATS Doc Matter community. Join today at thoracic.org/join.
Well, as a parent, one of the things that was so sad reading this analysis is actually how many kids were in the studies that they had. Treating adult smokers and trying to help them quit is already so hard, but at least we have all this trial evidence. And just thinking about my poor pediatric colleagues who are just, floating in the wind without really good data. So the second thing we're here to talk about is a great document that the American Thoracic Society put together to try to help provide guidance to our pediatrician colleagues. And they've released a guideline called Treatment of Nicotine Use in Adolescents Under 18 Years of Age, an official American Thoracic Society clinical practice guideline. So can you review their key recommendations with us?
Sure. And first of all, I think that their methodology was also very strong in this era of, getting experts together and discussing a topic and then giving recommendations. Like old school, that's exactly what would have been done, and people would have just written down what they, recommended. Now in the modern era, like they have these specific techniques for developing the questions, like vetting the questions, and then like working to see if you actually get consensus or not. And so I was really proud of this group for the work that they put in to give these recommendations. And what they came up with was like five main recommendations. And they basically all have to do with, caring for adolescents who have a nicotine addiction and what's the best way to try and help them. And so the first one is, whether we should offer counseling, and that was the strongest recommendation agreed with by almost everybody, even though there was low certainty of evidence. And that comes back to your main point that that's the reason they convened this panel of experts, is that there's not a lot of data out there. And so they had to utilize as much adolescent data that they could, but also adult data to try and come up with these recommendations. Recommendation two was whether they should use technology-based interventions like apps. So now there's actually several different quit apps available on the market. Some of them are better than others. So for that one, they conditionally recommended it and say, again, very low certainty evidence. And then 3, 4, and 5 are all medication based. So recommendation 3 is whether they should give nicotine replacement therapy to adolescents who are trying to quit. And they did not reach consensus on that one. So that one is actually not recommended as part of the guidelines. But interestingly, when they did interview a mom and her son who had gone through an addiction, that was the one thing that they disagreed with, the mom disagreed with. So she felt like nicotine replacement therapy should be offered and that primary care physicians, pediatricians should be trained better on how to do that. And then 4 and 5 are both the big drugs that we use with adults, so varenicline and bupropion. And both of those were conditionally recommended. Again, very low certainty evidence, but because they're so powerful at helping adults with tobacco addictions, the panel decided that this should be an option for pediatricians to treat their patients.
Yeah, what in particular struck you about this document?
I thought it was very thorough. So I felt like somebody who is outside of the field or maybe hasn't done a lot of tobacco counseling, they can really find everything they would need in this document. So the introduction, like very, is written very high and tight, but really goes into detail about, all the different use patterns in adolescence and what people should be looking for in terms of the types of things that they're using. And then they really went into detail about who should be screened for tobacco use, how you should do it, the differences in terminology. And then for each question, they give a little bit of background and then they really summarize like every single piece of evidence that they used to make their recommendations. And again, they did it in a very concise way that I felt was really readable, so to speak. And then at the end, they sort of said their recommendation, the quality of evidence, the benefits versus harms. And then they also added in like what other groups are recommending, which I thought was great because yes, we all love the ATS. The ATS is great. They give really good guidelines, but it's also nice to see like where they fall across the world and across just other societies. And so they put their guidelines in context of what the other groups are also recommending.
And that just helps us see, which areas are crying out for research. It's heartbreaking to see a guideline about how to help kids starting at the age of 10, which is the age of my youngest. But it just shows how much we need to invest in research in this area until hopefully we can just stop having nicotine use in adolescence entirely. It would be
Wouldn't that
great.
be amazing?
So,
Reach for the stars.
exactly. So based on, your entire career, which obviously has been exploring this, and then with these two powerful new documents that have come into the world of literature on e-cigarettes, what key takeaways do you think people need to understand about the health risks of e-cigarettes in young people and what we can do to help them quit?
I think number one, the most important takeaway that I feel everyone should know, and very much so kids themselves, teenagers, young adults, and parents, is that if you start to vape, you're much more likely to use other inhalants, including combustible tobacco and cannabis products, and that it also increases your rates of picking up alcohol and even binge drinking. So when I've worked with groups that specialize in interacting with children and teenagers, they've really made the point that, educating them is critical. So providing them information so that they can make their own decisions, because of course you can't tell them what to do. My kids, of course, are like, "Oh, I'll never vape, mom." And I'm like, "Can you write that down and sign it and date it?" And yeah, I'm going to hold you to that. But yeah, providing that data and making sure that they know about those risks in particular they're not as responsive to some of the downstream health effects. So I personally think the asthma data is like the second point that I would take away, that just how we know that people with asthma, like cigarette smoke is a big trigger for a lot of them. They have lower cigarette smoking rates. And more of them are picking up vaping, but now it looks like there is, a clear tie between getting diagnosed with asthma, having exacerbations, and vaping. But when I tell kids, teenagers, young adults, like that just is not as impactful in their mind. And so I think the third point would be the mental health, because that's such a huge problem in our young people right now with like extremely high rates of, anxiety and depression. And unfortunately, a lot of them like think that they're self-treating with vaped nicotine or vaped cannabis, because in that moment it makes them feel better, but they don't understand that it actually drives both anxiety and depression, and it'll get much, much worse, and then it's very hard to quit. So yeah, all of those are like really important points, and I think the other one is one we talked about quite a bit, being that researchers, policymakers, physicians like really need to engage with our target populations so that our communications are clearer and that we each understand each other better, and that that's going to lead to better outcomes overall.
Absolutely. Well, I want to thank you for your career trying to help us understand these e-cigarettes and for taking care of patients and, raising kids, probably the hardest job. Um,
Fair.
is there anything else you want to add?
Um, I guess like in terms of the data that I really think is missing, is the effects on neurodevelopment and even lung development. And that's mentioned in these articles as well. So, kids, their brains develop and their lungs develop until their mid-20s. So if they start vaping, when they're 15, that could lead to 10 years of, effects on the brain and the lungs. And at least in mice, we're seeing profound effects on the neurologic system, including behavior and intellectual capacity, basically. And I am just really worried that we're going to see the same thing in young people, that they're going to end up with decreased lung function at, their peak of like being around 25. They're going to start with a lower peak. And so then in decades down the line, this is going to lead to more symptomatic disease in them. And then, of course, the brain, we just have no idea what's going to happen, but I'm really worried about that. Need a lot more data.
Absolutely. Well, that's always the answer, right?
Right. That's so easy too.
Yeah. Well, thanks everyone for joining us for this ATS Breathe Easy podcast, and make sure to be a voice in your own community for clean air and tobacco control.
Thank you for joining us today. To learn more, visit our website at thoracic.org. Find more ATS Breathe Easy podcasts on Transistor, YouTube, Apple Podcasts, and Spotify. Don't forget to like, comment, and subscribe so you never miss a show.